Hello and welcome to Medical Dialogues. I'm Dr. Kinma Soni. Here's what I bring to you all from the world of medicine. Rheumatoid arthritis and its influence on atherogenic lipid disruptions. A recent study published in the journal Gene Expression indicates that rheumatoid arthritis, a systemic autoimmune disorder, can contribute to the progression of atherosclerosis. Rheumatoid arthritis, an inflammatory autoimmune disorder, leads to the production of inflammatory cytokines due to the immune response, which significantly disrupts lipid and lipoprotein metabolism. There are certain inflammatory mediators responsible for the progression of rheumatoid arthritis, like inflammatory cytokines such as interleukin-6 and tumor necrosis factor alpha, which influence lipid and lipoprotein profiles by modulating gene expression and metabolic pathways. Other inflammatory mediators such as C-reactive protein modify the behavior of low-density lipoprotein, which ultimately leads to development of atherosclerotic plaques. Myeloperoxidase, an additional inflammatory mediator, generates reactive oxygen species that compromise the effectiveness of high-density lipoprotein. As a result, high-density lipoprotein becomes less efficient at transporting surplus cholesterol away from the cell. This impairment in high-density lipoprotein function contributes to the progression of atherosclerosis, a condition characterized by the accumulation of cholesterol and other substances in arterial walls. In patients with rheumatoid arthritis, triglyceride, total cholesterol and LDL cholesterol levels are generally higher, while HDL cholesterol levels are typically lower. Despite these general patterns, there is considerable variation among individuals with rheumatoid arthritis. This variability indicates that lipid profiles specific to inflammatory conditions may offer useful insights for monitoring the disease and assessing risk. Small, dense, low-density lipoprotein particles pose a greater risk for atherosclerosis compared to larger low-density lipoprotein particles, as these altered low-density lipoprotein particles accumulates within the walls of blood vessels. They contribute to the development of atherosclerosis. Researchers reveal that exploring the underlying mechanisms and clinical outcomes of these disturbances can help identify new approaches for preventing and managing cardiovascular disease in this high-risk group. That's all for now. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.